Hi everyone, it's once again my Sunday 9 p.m. live video on women's health, which I've been running since the beginning of MCO until now. That is many months already, and I have covered actually many topics. And if you're interested to look at all my old topics, you can always go to my YouTube channel, Dr. Tan CT Clinic, Dr. Tan CT Clinic, yeah? Go there, subscribe, and browse through all the videos that are available and go through and get more knowledge on relevant things to your day-to-day, especially all women out there, okay? I cover almost every topic that is related to women already. A lot of information already in the YouTube channel. So if you want to know more, please go there. Today, I'm covering a very interesting topic because why I decided to do this topic is also partly because this is something new. It's something new. Not many people talk about it. Can you imagine? We only discovered it in 2001. I mean, we already knew all these things all along, but it is much more well established after 2001. Or after the year 2001. Can you imagine? It's only 19 years ago. And we are talking about 19 years ago, somebody discovered it and established it. And that people is not, of course, sad to say, not a Malaysian. So something like that has been discovered and established in the overseas and slowly coming into our country now for this year, especially this year. If you look at many of our conferences, as well as especially overseas conference, not so much our local ones, but the overseas conferences and workshops, almost and many, when I look through and I browse through, and I will see this topic in almost all the conferences this year. So it is the hot topic this year. All the conferences worldwide, they are trying to create awareness among all the gynaes. Oh, gynae, please know this thing, you know. So it's something really new even for doctors, for me, for many of the doctors out there. It's not really that new. We do know a little bit here and there in the past, but no one has actually established it and made it so clear now what is it, what to do, and what needs to be done. So this is something really new, and I wish to bring this new information that I recently discovered because I attended one of the overseas conferences, and I wish to bring this to all of you today. Actually, sometime last month, I attended a world symposium on gynae, and that is when they talk about this topic, and I find it really exciting, and I think women out there need to know. Because why? Many women out there today have a Caesarean birth. We have a Caesarean birth, you need to know about this, and you need to know what you need to do. I have been seeing many women who come to me with this problem, and very typical story I always hear. And in fact, I just had one last week also, that these women would usually tell me that they have this little bit of spotting. They have this little bit of spotting every month. And they have seen so many gynaes, Some gynaes give medicine, some gynaes give antibiotics, some gynaes give hormone tablet, some gynaes give oral contraceptive pill, but all gynaes say the same thing. I think you are stressed. I think you have hormone imbalance. All the gynaes say the same thing. But they don't have stress already. No hormone imbalance already. They take hormone tablet, they take oral contraceptive pill, but still the spotting continue. And these things I have been seeing over the last few years, and I have been seeing this problem, and I have been telling the patient, this is because of your Caesar scar. And I have always suspected this because I do hear a bit on and off when I go overseas conference. One thing about me, I only go overseas conference. I don't like to go local conferences because they're always outdated. I go to overseas conference every year. So this year, cannot go overseas, so we attend virtual conferences, and again they talk about it, but now it is very established. Previously they also talk about it, but they do not explain so much detail because this thing we have discovered since 2001. So I do hear this issue being mentioned in many overseas conferences that I have been many years over the years, and that is why I have been telling a lot of patients that come to me, and they have been seeing many gynaes. And why the gynae don't know is because this is new. I don't blame the gynaes, but now, because this year itself, almost all the conferences that I looked through, all the overseas conferences, they are talking about this. So I decided that, yeah, this year is the year everybody is trying to spread this news to as many gynae there are out there all over the world. So I also want to share with all of you, since it's so much more established now, we want to talk about this complication of a Caesar scar, okay? So there are few things actually all these years I have noticed it. I've noticed it on and off when we do an ultrasound scan on a lady who had a previous cesarean. We can actually see a gap. We see a gap in the Caesar wound. We see a gap in the Caesar wound. And now with newer techniques of ultrasound, we call they call that saline hysterography. That means they put water into the saline sonography. So they put water inside the uterus and then they do the ultrasound. That is clearer. But even without water, we do see it on and off. We do see the gap. What do I mean by the gap? I think if you come to me, you never tell me any problem. I scan, I see the gap. Not often I tell you, hey, you got a gap in your Caesar scar. I may just say everything is normal because it's not disturbing you. So sometimes let's not make everybody so worried. But since today we are talking about this talk, I'm going to focus on this gap. So what do I mean by gap? So number one, this thing is best seen with the vaginal ultrasound. From the tummy, sometimes can see, but not always can see. But from vaginal ultrasound, it is a lot clearer. And it is most clear when you put water inside the uterus and do the vaginal ultrasound. That will be the clearest. Then you won't miss it at all. So let me show you what a vaginal ultrasound will look like in any one of you. Something like this. This is what a vaginal ultrasound will look like, a normal vaginal ultrasound, okay? So what I mean by the gap, look at this. Same ultrasound picture, but can you see the gap? This is a gap in the wound, in your Caesar scar. So to compare, I have a picture of comparison. So they are both the same uterus. This one, I don't see the scar. There's nothing, it's nice and smooth. So this person has a nice uterus, probably no Caesar at all. And this is one with a gap. So what happened is that sometimes our wound do not heal so well. We do not heal so well, but we do not know. Because all this while, this thing is not established. So because it's not established, when we scan, we see also, we saw. I think most gynaes on and off do see it. But we saw, and we say, we don't say anything. Because it's not an established problem. All this while, we don't even know this is a problem, and there is no name for this problem. So nobody talks about it. But the complications of this Caesar scar, we already know for decades and decades and decades. But we have never established this gap. We never give a name to it. We never talk about it. We don't do research about this gap. So now they have done a lot of research about this gap. They actually gave a name for it already. It's called isthmocoele, or sometimes we call it a niche. It's a niche, like a gap, a small hole, a small little tiny gap in your Caesar scar. So why do you have this gap in the Caesar scar? It can be, number one, during the suturing, closing of your uterus, there was at one time a trend that we shouldn't sew it 2 times. Actually, in a Caesar, we always sew it double. Sew 1 round and sew double, 2nd round. But there was at one time like fashion like that, you know. They want to compare and they say, maybe it's okay to just sew 1 time, no need sew 2 times. Why you want to sew 2 times? So there was at one time like a fashion like that. But it's all over because the Royal College and many people did research to compare, and they say, no, one time is not safe. So we also worry maybe you happen to be during that time when you had a seizure during that time when they like to stitch only one round. It is somewhere also, you ask me, early 2000s. There is a trend at one time. Okay, so let's say you only stitch one time, could be a problem. Or if the doctor stitched that time, they didn't take a full bite. That means they just close it up. But there are certain areas that they forgot to take a full bite, because it's quite common to have that problem. Why? Because your uterus is so big. So when you take out the baby, sometimes the whole wound actually pull open. So certain parts, the muscle actually retract. So the muscle retract. So sometimes when we stitch, we may be only stitching the skin of the uterus and not the entire muscle of the uterus plus the inner lining. Because actually uterus have 3 layers. They have the outer lining, the muscle and the inner lining. You are supposed to stitch all 3 together, but sometimes the muscle pull out. So there is it's quite difficult to bring it all together. So sometimes maybe miss certain area, not the entire wound, because most of us gynae, we know we need to take all 3 layers. So we also worry maybe certain areas missed out, or it could just all be part and parcel of wound healing. That means we stitch up properly, but somehow the wound open, which can happen because even you see for natural birth, we definitely stitch nicely already, because it's in front of our eyes, so easy to see. But sometimes the wound also open up. So wound can still open up. So there is still a possibility that it happened because of wound healing. So when your Caesar wound healing, if let's say it opened up during the healing process, you will have this gap that I show you. So what do you call the name of this gap? In simple terms, we call it niche. And the medical term for it is called isthmocoele. So in the year 2001, some doctor in Europe named this thing isthmocoele, and that's how it all started. So just for those who have just joined me, this is the uterus, a nice healthy uterus. And if you have a gap, this is the gap that you have in a Caesar scar. So if you have this gap in a Caesar scar, then it is called isthmocoele. And this gap does cause problem. So if you're going to talk about early days when I was a doctor, I don't see so much of all these problems. I don't see women coming to tell me about this spotting that they get every month. I don't also see other complications that I will talk about later, like Caesar scar, pregnancy, and also placenta accreta. I mean, we do see a bit of placenta accreta in the past, but it is also getting more and more today. Why is it getting more and more today? Why do we see more Caesar scar pregnancy today? Why do we see more placenta accreta, increta, percreta today? Why? Because there's more and more Caesar. Just like I've talked in many of my videos in the past, 20 years ago in Malaysia, only 10 to 15% of births are Caesarean. So 85 to 90% of all births are natural birth. So only 10 to 15% is Caesarean. But today, 20 to 25% of births became Caesarean already. So we do Caesar more and more. And the reasons I also mentioned earlier, why? So we do Caesar more and more. And because we Caesar more and more, we also see more and more complication. So this complication is worldwide. The whole world already know there's more and more this type of complication. And because we know there's more and more this type of complication, and now we already established this diagnosis of isthmocoele since 2001. So more and more research are done. So now it's very clear. We know that all these things is due to the gap. Last time, we don't know. We know there's such thing as Caesar scar pregnancy. We know there's such a thing as placenta accreta, percreta. But we didn't know that actually you could see this gap, and we also didn't know if I see this gap, what am I supposed to do? So now it's very established. 19 years already since the establishment of this diagnosis. Research has been done, and now we know what to do and how to prevent. So let me start from the very beginning. Isthmocoele, number one, the first thing it can affect is it can affect you as a lady with a previous Caesar. You may have certain symptoms. What is it? Number one is the little spotting that you get every month. And that is what I mentioned, that some women with this gap, they actually get it every month. But not all. But these women are the ones that keep seeing gynae 1, gynae 2, gynae 3, gynae 4, gynae, because it's so disturbing, right, to get this bleeding every month. So this little bleeding every month is due to this isthmocoele. So you have to solve the isthmocoele to be able to stop this bleeding. You take oral contraceptive pill, yes, your bleeding is okay, but you stop, then the spotting come again. So how are you going to take oral contraceptive pill forever? Or are you going to treat this problem? Number one. Number two, the other pain they can get is period pain. But their period pain is not just any pain. They have this one spot they can use their finger and point. This place pain, and it's usually just above where the Caesar scar is. So when you have Caesar scar pain at a one spot every month, we do need to think about this isthmocoele, or we can think about Caesar scar endometriosis can also happen. So they can usually tell you period pain that happens only at that spot, or they will just tell you, ever since my Caesar, I on and off have this pain. Doesn't mean have to be during period, it can be any time, but have this pain at this spot. Again, they use a finger and point. This spot, there's a pulling pain at this spot. Finger, use finger and point. So when you scan, you see the gap, you see this isthmocoele, then you know that, yes, there's a possibility that this patient have isthmocoele. So when you see this, then you must explain to patient and you tell them what are the options you can do. I will talk about the treatment later. Okay. Second thing we want to talk about is fertility. Now it's established that this gap, this isthmocoele, can also cause a woman difficult to get pregnant. Okay, long ago we also know. Long ago we already know. Women who give birth naturally and women who give birth by Caesarean. Those that give birth naturally, they actually very much faster get pregnant again compared to those who give birth by Caesarean. Let's say I have 100 women, 50-50 from each group, both want to plan pregnancy from today. Both of them got one baby already. One group, the first baby, they give birth natural. One more group, they give birth by Caesarean. We always know that the number of women who cannot get pregnant is higher in the Caesar group. And even if they can get pregnant, the Caesar group always get pregnant slower. So we know that Caesar affects fertility, but in the past we don't know why. So now we know one of the reasons is due to the isthmocoele. One of the reasons, there may be multiple reasons, but one of them is due to this isthmocoele. Isthmocoele causes fertility problem just like other conditions like endometriosis as well as hydrocephalus. What does hydrocephalus or endometriosis have in common? They produce toxin. They produce toxin that affect fertility. These toxins can kill sperm, can kill egg. Can you imagine you have an isthmocoele at that part, at the entrance of the uterus, at the lower part of the uterus? That is the place where all the sperm will go through, right? All the sperm have to go through the isthmocoele. And if the isthmocoele is toxic, it's just going to kill all this sperm. How to get pregnant? You see, it is actually because fluid can collect in this isthmocoele. That is why you get this spotting every month. The fluid can collect in this isthmocoele. And the fluid that is collected in the isthmocoele is very toxic. It's all period blood. And you have all this sperm going through this toxic material. It's like throwing the sperm in a dirty drain, you know. Because if you see all this fluid that come out, it's really like the dirty water. in the dirty drain. So you have sperm going through all this dirty water. Die lor! How to get pregnant, right? So that is the second problem, fertility. First problem is symptoms that they can give you, but not all women will have the symptom. In fact, as I said, I scan, I see a lot of isthmocoele. But many of these women are very happy in the sense they have no pain, they have no bleeding, they are good. They are good, I'm good. I'll tell them, your uterus is perfectly healthy. Because uterus is healthy, it just has a gap in the scar. But it's healthy. But for the sperm to go through, then it's going to kill the sperm. Because in this particular conference that I went, this World Symposium, they actually brought this lady who have seen so many doctors with this isthmocoele. And she's very stressed because she can't get pregnant and she doesn't know why. And everybody who scanned her, fertility doctors who scanned her, just told her that everything is normal because she have a healthy uterus. But all she had was a gap in the Caesar scar. Then the second thing is Caesar scar. Third thing is Caesar scar pregnancy, which I mentioned earlier as well. Caesar scar pregnancy. I will show you some picture of what is Caesar scar pregnancy. Let's go back again. This is normal uterus. This is where the scar is supposed to be. This is a healthy uterus without any problem. This is the gap that you have. Okay, remember this is the uterus and this is the gap you have. And in Caesar scar pregnancy, this is what you see. This gap has a baby inside. Can you see this gap has a baby inside? And Caesar scar pregnancy itself, last year itself, I saw 2. It is quite sad to see this so many. You ask me, the first 10 years of my life as a gynae, I never even see 1. But last year itself, I see 2. Why so many? It's all because Caesar operation has gone up. So that is one of the problems. So we need to prevent Caesarean section. This is something we need to do. Because when you have more and more Caesar, then all these complications go up. And I tell you, it's very sad if you have this pregnancy. Because you have to choose between the life of the mother and the baby. Only one can live, not both. So answer is very obvious. We usually sacrifice the baby, we keep the mother. So it's very sad. We have to tell a mother a very sad story. I will tell her, sorry, your pregnancy is at a Caesar scar. And the best thing to do is to sacrifice this pregnancy. We have to remove this pregnancy and you try again another time. It's very sad. Very sad to tell mother that you have a healthy baby, heartbeat is there, but we need to give up on this pregnancy. I had 2 of these cases last year and the 2 of them appeared at a different time. One came at very early stage, which is at this stage, where you just see a small little sac and a baby there. So as usual, I will ask her to go and see another doctor to confirm. Because we want to remove a pregnancy, you must have a few doctors to confirm that it is a Caesar scar pregnancy. So we confirm and then we advise and then we remove the baby. We told her to get pregnant again. But actually, get pregnant again, if you are lucky, you may not get it there. If you're not so lucky, you will again get it there. But I saw a second one which is even more sad. Because this lady comes from Kedah, she's not from KL. So she has seen many doctors in Kedah. She has been bleeding and bleeding and bleeding and many doctors she has seen and all the doctors, be it government, private, they have all been giving her Dufaston, but it didn't actually stop her bleeding. Nobody detected the Caesar scar pregnancy until she came to see me. But by the time she came to see me, it was already a 4-month-old pregnancy. And she's still bleeding at 4 months. It's already quite bad already. And she's from Kedah. So all I could do is write her a letter, go to Kedah, one of the government hospital, and get it seen. But I do not know what happened in between. I did tell her that because by 4 months, we cannot just remove the baby. It's not so simple anymore. If we remove the baby, the mother's life is at risk as well. I do not know what happened after that, but sometime later she PM me on Facebook that actually her entire scar ruptured. She lost her baby and she also lost her uterus. Sad. Sad. Because that is at the end the outcome. Because if the scar rupture, because there is a gap, you see your scar have a gap. So when your scar have a gap, this outer layer is so thin, it cannot hold on to a pregnancy that keep growing and growing and growing and growing. And that is why the scar will rupture. And if the scar rupture, the baby will die. Because the entire thing is opened up already. The baby will be exposed inside the tummy together with your bowel and everything. And then you will bleed like crazy. So the only thing the doctor can do is remove the uterus. If let's say at 16 weeks when she saw me, if we don't want that to happen, what could we do? The same thing, we will remove the uterus with the baby inside. So no uterus, no baby. So the only way is early detection. If we knew it early, like in the picture I show you, then we remove the baby, we keep the uterus, we keep the mother. Mother is safe, uterus is safe, but no baby. So this is Caesar scar pregnancy. So we want to avoid Caesar scar pregnancy. Many years back, I had one also. That one also we detected a bit late, about 13, 14 weeks. Also the same, I sent to fetal maternal specialist. They also say do a hysterectomy, remove the uterus, remove the baby inside. I told the mother, if you don't want to go on and end up with bleeding, ICU, blood transfusion, life-threatening, because if you go on with the pregnancy, the Caesar scar is going to open up. You're going to lose your baby anyway. You're going to bleed until you almost will die. And still I have to remove your uterus. Might as well now we remove your uterus with the baby. So many years back I had one, I removed the uterus with the baby. No more uterus, no more baby because detected late. So last year, this one case that I had, she was a regular patient of mine. So we detect early. I'm not sure, I don't think she saw me right from the beginning of pregnancy, but she has been seeing me before that for her previous pregnancy. So she came to me quite early. So I saw it and then I also sent her to the fetal maternal to double confirm there is a Caesar scar pregnancy, and then we do a DNC, remove the baby, but we keep the uterus, we keep the mother, and the mother can still get pregnant. So knowing it early would be better. But of course, think about it. If I knew it even earlier, and if I've treated it, if the gap is already closed back, then I don't have this risk at all, right? So these are the things to ponder. Then, last of all, which what we call placenta accreta, percreta, all these abnormal placenta. So if you have a pregnancy at the Caesar scar, what's going to happen? What will happen is because you see the gap is very short. When you have no space, because now the gap is so little. The gap, this is the gap, and the normal part of the uterus is so thin now. When the pregnancy and the placenta ends up there, you must understand placenta wants to look for nourishment, right? They want to look for oxygen, nutrient. They want to look for all these things. And when they want to look for all these things, they have a placenta, right? So when you have a placenta, all the place that is so thin and they cannot get the nutrient, what are they going to do? They're going to be exactly like a cactus tree. You know a cactus tree? Our placenta is like a cactus tree. So when you have a cactus tree, when he cannot find water, he'll just grow a lot of roots, right? A lot of roots go deep inside to find the water, right? So same, our placenta, when they cannot get enough nutrient, it will grow roots all the way into the bladder, the bowel, everywhere to find nutrient. So that's why you have those placenta that cannot remove. And placenta accreta is when placenta, those we call abnormal placenta, like accreta, percreta, increta, the three names, depends on how deep the placenta has gone. It's all because it is on the Caesar scar that is not giving enough nutrient. You see, you have a gap. It's so thin there. How to give nutrient? So this whole spectrum, whether your pregnancy will end up with a scar rupture or whether it won't rupture, it will still go on throughout 9 months, but only thing you get this abnormal placenta, or you can still have a healthy placenta and healthy pregnancy. All depends on, number one, the gap, how big the gap, and how deep the gap. Now we know a lot of research, we all look at this gap and the depth of the gap. So we look at how deep it goes. If it's more than 50%, the risk is high. Less than 50% of the entire thickness, the risk is not so high. So now, because a lot of research done already, 19 years we know about isthmocoele. So we know the gap of the thing, if the thickness, if it's covered more than 50%, the risk is high. Okay, but if it's less than 50%, then the risk is low. So you see, but we also know that it may not be a Caesar scar pregnancy, because you have a gap there, but your pregnancy can stick elsewhere. It doesn't have to stick at the Caesar scar. But if you have a gap and you have a Caesar scar there, a pregnancy there, then it becomes high risk. So now we talk about treatment. Treatment, there are multiple things you can do. Sometimes we say if it's not disturbing you, you don't want to do anything. Let's say, because you get pregnant, not necessarily a pregnancy has to stick at where the gap is, right? It can be very good pregnancy, go high up in the uterus. Okay, it can. So it not necessarily can happen. So if it's not disturbing you, and you can still get pregnant, and it doesn't give you pain or this spotting that you get every month, you can leave it alone, because it is a gap, but you still have a very healthy uterus. But when it gives you problem, let's say it gives you problem because you cannot get pregnant. It gives you problem because you keep bleeding every month. Every month you have this spotting that disturb you every month. It keep giving you problem because you have this pain every month when your menses come. It gives you problem because it cause you pain every day or every other day. Then of course we need to treat. Of course we need to treat. So how do we treat? So number one is we treat with, let's say, it depends on what is your problem. It all depends on what's your problem. What you want to treat it for. If it's just maybe the spotting every month, of course if I give you birth control pill, settle lah. So actually most of the mothers who come and see me with this spotting and they say that they have enough children, then just go on birth control pill for the rest of your life lah, until you menopause, no problem. But if you don't want to be on pill, then you can do a simple surgery, not a big surgery. We just do a scope from below, from your vagina go in. From your vagina go in, we scope inside, we look at the scar, and then we just do a simple surgery. We clear off the places that are causing this bleeding, and we burn off the whole place. Then your problem solved. Okay, we problem solved. Let's say if you are trying to get pregnant and you cannot get pregnant and you have this isthmocoele, also same thing. I can just put this scope in, look for that gap, and then clear off all the, we say the unhealthy tissue around there, and then burn around it, and that's it. Settle already. You don't have all this accumulation of dirty fluid. Your sperm don't need to go through a dirty longgang already. So that will solve your problem. But if you're talking about worry about Caesar scar pregnancy, then no. Then it still involves a surgery. So usually this surgery, we may do it during people whom we know that you have Caesar scar pregnancy, then we can do it on the spot. Or for those people who had Caesar scar pregnancy before and they're very worried, or we can see that the Caesar scar, the gap is more than 50% of the thickness, so we do worry about scar rupture, then we can actually do a formal repair. But don't worry, repair, whenever I say repair, everybody will like, operate again nah. You know, you just had Caesar, nobody wants to do a Caesar again, right? No, yeah, we need to still operate on you, but it is usually done either laparoscopic or robotic. So we either do laparoscopic with just 3 holes on your tummy, we go in, we find the gap, we clear the gap, we stitch back. Because most likely it's a wound that is opened up, either due to when the stitch didn't complete stitching, or your wound itself didn't heal well. So this time we will clear up, get all the healthy tissues to come in, then only we stitch back. Okay? So that's how we treat. So the question is whether we need to treat or don't need to treat. It all depends, because if you're worried about Caesar scar pregnancy and placenta accreta, all this, you need to look at how much gap you are left. Caesar scar pregnancy may not happen. The chances is not very high. It's probably only less than 1%. But scar rupture can be something that we are very worried. And if you want to try natural birth and you worry about scar rupture, if you see your scar, the gap is so big and the lining is so thin, more, or maybe your gap is like more than 70-80%. If you don't want to take the risk, it may be good to repair it before you're pregnant again. Of course, those who cannot get pregnant, if you have a gap, you want to get pregnant, you need to do the surgery. Not necessary, you need to repair. Of course, a repair is always better than just clearing. But clearing is a simple surgery. It's better than not doing anything. Clearing is very simple. I can do today, finish in 10 minutes. You can go home today, and then next day you can still go back to work. So it is a very simple surgery. If you just clear it from down there, that means from vagina, we do a hysteroscope. It's a hysteroscopic procedure. We go from the vagina into the uterus and then we clear it. And last of all, for all those who don't plan to be pregnant anymore, then if it's disturbing you, if it's not disturbing you, just let it be. If it's disturbing you, then you either go on long-term birth control pill, or you just do this simple surgery and just clear it off lah. 10 minutes thing, and then next day can go back to work. It is so simple. After surgery, also no pain. It is such a simple surgery. Okay? So that's all I have to say. So most importantly, I just want to stress again that back to the same principles that I've always believed in, we should try our very best to reduce cesarean section, because only with reduction in cesarean section can we all avoid all these problems. All these problems are more and more common. It's all because there are more and more cesarean today. So as I always mention, cesarean birth, to prevent cesarean birth, the responsibility now is back to you as women, mothers, to make your effort to prevent. Now I'm going to go through your questions. You have any question, please post up. Okay, now it's Q&A time. Let's go towards preventing cesarean. Let's reduce the number of cesarean sections. So to prevent cesarean section complication. Okay, Liana Ahmad said that she had 4 Caesar and I'm having fibroid. Is it from scar? No, fibroid is fibroid. Caesar scar is Caesar scar. Okay, Eva has something to say. So sad indeed, who knew they took a while to get pregnant? Private hospitals should really support natural birth and stop scarring first-time mothers that their baby is in distress, umbilical cord, neck, big. I know you like to, a lot of people, they are very angry with doctors who did the Caesar with them, when after some time they find out that maybe the Caesar is not necessary. But I always feel that the responsibility is back to the mother. Okay, the doctor maybe Caesar for the wrong reason, but my question is, why did you choose the doctor in the first place? And that is the biggest problem, because even my sister-in-law, I still remember, towards the final month, you can see the doctor is trying to find ways to Caesar her, because she has a very big baby, very big, you know. She gave birth to, I think, almost 4 kg. So the doctor wanted to Caesar her. I told her to switch doctor that time, and she told me already 37 weeks, where to find some more doctor. I say, my dear sister-in-law, you want to give people so much money, you think people don't want to take change doctor for goodness sake. And yes, and indeed she changed doctor, and even though she has a very big baby, she still delivered naturally, very fast and easy birth some more. So the responsibility is still back to the mother actually to choose the right doctor. And please join my VBAC seminar. I will explain to you a bit more on doctors and also about mothers. This choice of doctor and mother relationship is very important. So you need to get the right doctor to meet your demand, because the opposite also can happen. The last 2 weeks ago, I had talked on VBAC and I did explain again the opposite, where the mother very angry with the doctor for not caesarean her, not doing the Caesar at the early stage. You see, it's again a discrepancy. Both ways can happen one, okay? Hanasha asked, Doctor, can a Caesar scar pregnancy detected by UPT? Oh, no. UPT cannot tell. You need an ultrasound scan. That is why it's very important to do an ultrasound scan at 6 weeks. What is 6 weeks? It's 2 weeks after your pregnancy test positive. When your period delayed, within the first 1 week, you can do a pregnancy test. And if your pregnancy test is positive, in the next 1 or 2 weeks, you must have an ultrasound scan to detect whether it's in the uterus at the right place or not. I think this Kedah lady is also due to this reason, because many people, when they want to go, especially government clinic, they may not go so early, they're pregnant, they just, dilly-dally, maybe just buy their own folic acid and then wait maybe around 3-4 months, only go and see doctor. But that can be a bit too late already. So always go within 1 or 2 weeks after your urine test is positive. But it can also be a problem with Caesar scar pregnancy, because Caesar scar pregnancy tend to bleed. So they have bleeding, and then so some mothers may think that they are not pregnant, they thought it's period. So how to know if you are bleeding, whether you are pregnant or not pregnant? So you know because the bleeding is not normal. When you have normal menses, then you are normal menses lah. If you have bleeding that is like very little, like not coming out, always fast, go and do a pregnancy test, because it may be a Caesar scar pregnancy. Mariam, thank you very much. Mina, is the ultrasound available everywhere? I think ultrasounds are available everywhere. The question is whether doctor look for it. And because this is still a very new thing, and currently I only see it in international conferences. So doctors who, if never attend the international conference, they may not know this so soon. Maybe in 5 to 10 years time, all doctors will know if this thing is presented in our local Malaysian conference. Because some doctors mainly go for Malaysian conferences only because they're very busy. Some doctors very busy, they won't stop work. They want to work every day, so they won't go far. I love holiday. Oh, got conference holiday then I like to go overseas. So that's where I learn new things, okay? And once you go overseas, you don't like to attend local conference because local conference got nothing to learn already. Hanasha asked, I have spotting after my second C-section in 2018, which started last month. Where should I refer to get checkup? KK or hospital emergency department? Neither. You go KK, probably don't know what's wrong with you. As I said, this is a very new thing. If you go to emergency department, they are not emergency, they'll probably shoo you off. But of course, you need to go to KK first to get an appointment to go and see gynae. So you can always ask, what I would do for you, Hanasha, I will wait for another 2-3 months. If this spotting persists for another 2-3 months, then I will go to, if you want to go government, then you go to KK first, and then you tell the doctor that I'm worried my Caesar scar got gap. Doctor in KK may or may not know this thing. Always, there's always my video. You see, my video is always here. Like I previously always tell a lot of patients, take my video, show your doctor and say, I want this. So show this video to your KK doctor. Your KK doctor will be puzzled and don't know what. But at least he'll write you a letter lah. She'll write you a letter and refer you to the hospital gynae department. And when you reach there, again, same thing, your gynae department in government hospital, sometimes also no specialists. And again, show this video. So go to my YouTube channel there and find this video. Normally within the next 1 week, I will upload it in my YouTube. Go to my YouTube channel and find this video and then show to the doctor and ask her whether I have this or not. Okay, because I show all the ultrasound picture there. Any doctor who know how to do ultrasound, see the picture, also know how to look for it. It's nothing special. Okay, Shida asks, what's the VBAC success rate for someone with endo and adeno in the last pregnancy being C-sec 5 years ago? Endometriosis does not affect your chances of vaginal birth. The only thing is your adeno. But that also depends on whether your adeno is very bad or not so bad. So depends on how many percentage of the uterus is affected by adeno. We look at percentage, then we can roughly tell. But actually, most endos still can have natural birth one. Only the very, very, very bad endos have difficulty. Okay? But honestly, at the end of the day, adenos, people with adeno and endo also some of them, they have a stubborn cervix. So you need to understand stubborn cervix in order to know what you need to do with your VBAC. So do attend my VBAC seminar next week, yeah? Mel, yup. Doctor, is it normal to have Caesar scar pain after 2 years? Sometimes, like when pressing the tummy, it's not normal. So there must be some reason why you have the pain. So it's best if you could see a gynae to see if you have a Caesar scar gap, the isthmocoele. So if your gynae do not know what's the isthmocoele, please show the video, okay? Or use this word lah. Say, gynae, ask your doctor, do I have an isthmocoele? Then at least he will Google. Okay, Choi Lin asks, Doctor, is it a must to do Caesar for breech babies? No, Choi Lin, no. So if you want to know more, please attend my VBAC seminar or my usual online parenthood. Or you can actually go to my YouTube channel. I have a video already on breech. Go to my YouTube channel. Okay, breech no need to Caesar one. Okay. Samantha Lee asks, first pregnancy, Caesar due to poor progress. Second pregnancy, still got chance for VBAC. Of course, but you definitely need to do a lot of homework already. Samantha, please attend my VBAC seminar because poor progress is a problem that can always happen again and you can do a lot of things to avoid it, okay? Josephine, you're most welcome. Hafiza, hi doctor, I was Caesar last 3 years due to poor progress. Is this chances of... Yeah, please attend the VBAC seminar. If you want poor progress, they tend to poor progress again. So if you don't want to poor progress again, you need to have knowledge of what you need to do. As far as I'm concerned, there's no such thing as poor progress because there's things to do. All my patients with poor progress, normally I would have done a lot of things to them. You want to know that? Please go to the VBAC seminar. Then you have knowledge. Then you will know how to prevent poor progress. For those of you who are pregnant for the first time, also good to know. Mel Yap asks, should refer to doctor to check whether Caesar pain after 2 years normal or not. I mean, it's definitely not normal lah, but it's nice to know what it is lah. But question is whether what you're going to do. So it's always good to know why first. And you see, if let's say you go and really you have this isthmocoele, the question is, will you do something to will you do another surgery to correct it? That's the only question you have to ask yourself. But it's always good to go and see. Always good to go and see a gynae, yeah? Yeah, Eva, thanks for your reply. One Nina say, you're most welcome. Is there any possibility for Caesar scar complication for any other operation as like a fibroid or cyst? Cyst, no, because cyst is not in the uterus. Fibroid is also on the uterus, so of course the complication is the same together with a Caesarean birth, but not all fibroids, we cut the whole uterus through and through. So it may not be exactly the same lah. So it can also have certain complications, but not exactly the same. So once again, just to highlight again that this thing is called isthmocoele, or in simple term is called niche, but to medical term is called isthmocoele. And to spell this isthmocoele is I-S-T-H-M-O-C-E-L-E. Okay, so sometimes if you need to ask your doctor, you may need to use this word, because don't blame your doctor for not knowing, because this is a new thing. As I told you, it's only established in 2001, this diagnosis. And it took many years for people to do a lot of research to know this diagnosis got what is the effect of this diagnosis. And also to, also you need many years for doctors to do research to, not just to know, but to know the treatment, what the treatment, how effective is the treatment, and what the effects. But now that we know, but this 1 year, they are widely popular, they are widely creating awareness among gynaes, but only in the overseas conferences. So doctors will still need a bit of time to be able to for Malaysian doctors to pick up lah. Okay, we are not US, UK, so we will still need a bit of time. So sometimes if you think you have isthmocoele and you worry you have isthmocoele, maybe it's best you show this video to the doctor, you know, the ultrasound picture to the doctor, or you give the word isthmocoele, ask your doctor, do I have this problem? If your doctor don't know, the doctor will go and Google. Once the doctor Google, the doctor will know. It's a very simple thing. It is very easy to detect in ultrasound. Every single gynae should be able to see it. It's not difficult to see one, okay? So I still have another 1-2 question coming in. I saw Kelly asked, I had a fibroid open surgery in 2018. Is it possible that I have natural birth after almost 2 years? Kelly, I cannot answer your question because fibroid, it depends on how big your fibroid, how small your fibroid, how deep is your fibroid, was it superficial, and during the surgery, what did the doctor do, whether it's true and true or what. It doesn't matter whether it's open or laparoscopic or robotic. It is the same risk that you're going to have, so it doesn't mean that open surgery is safer. Which is something a lot of people misconception. They think that open surgery is safer if they want to have a natural birth next time, if you don't get pregnancy next time. It's not true. It is the same. It all at the end depends on how big is your fibroid, how small is your fibroid, superficial and deep. That is the only thing we need to know. And the surgery itself, whether the doctor went through and through or not. So all these things only your doctor can answer you. Nobody else can answer you. So even with mothers who come to me and they have a Caesarean, they have a fibroid surgery removed previously, I also cannot decide whether they have natural birth or not. I will have to get the letter from their previous doctor because only what he operate that time, he knows whether you can have natural birth or not. No one else can give you this answer. You have to ask back your old doctor. Okay, so I guess that's all the questions you have today. So once again, if you want to have a VBAC, please go to attend my VBAC seminar next week. And for all of you who are trying to get pregnant and find it difficult, please attend my fertility seminar 2 weeks from now. Okay? So see you then next week, same day, same time. Do tune in again on Facebook, Sunday 9 p.m. Yeah? And for all the old videos that you want to refer back, please go back to my YouTube channel, Dr. Tan City Clinic. Please subscribe here. So all these live videos that I have here will be posted up within 1 week after the live video. And please subscribe. Why subscribe is because I have intention of improving my video quality. So I may not be doing live videos so much anymore so that the YouTube videos quality will be better. So in the future, it will be only YouTube video. Yeah. So please subscribe to my YouTube channel. Okay. Thank you. Bye-bye.